Half a century. That's how long it takes for a man to develop an enlarged prostate. And half of all men over age 60 will develop this condition, also known as benign prostatic hyperplasia, or BPH, a non-cancerous enlargement of the prostate, restricting urine flow. By the time men reach their 70s or 80s, 80% will experience urinary symptoms. You're about to meet some of those men who are losing personal freedom and compromising their lifestyle. Men who, like millions, experienced a variety of painful, annoying, and embarrassing urinary symptoms, suffering with an enlarged prostate gland.
At night, I was up to go to the lavatory about every 2 hours or less. I could almost set my watch by it. During the day, it was about every 1 hour.
The problem I was having was the little bit of pressure. There was still urine in the bladder, and I just couldn't relax.
It was a very uncomfortable kind of a situation. It limited my mobility. Because of the infection, I had some swelling. And in some cases, if I let it go a little bit too long, it was even difficult to walk.
There are many common symptoms, among them frequent urination, especially at night, a sudden need to urinate, a weak stream, or pain or burning during urination.
One thing that would always irritate me is that I would go out to lunch with somebody and the guys would be in and out of the bathroom in around 30 seconds, and after 2 minutes I'm still forcing my urine and nothing's happening.
The prostate is a walnut-sized gland that forms part of the male reproductive system. It surrounds the urethra, the canal through which urine passes out of the body. With age and time, the prostate enlarges around the urethra, causing pressure similar to a clamp on a garden hose. The result, urinary symptoms and difficulties.
It was kind of embarrassing because you had to, go to the bathroom a lot, and you can't tell people what's going on, and you just suffer through it, that's all.
Relax. Freedom to live your life is here. A simple, safe, and effective solution unlike any other you've ever heard of before. Introducing a revolutionary breakthrough that's becoming the new gold standard of care for treatment of an enlarged prostate. It's called Green Light PV Laser System for photoselective vaporization of the prostate, or PVP for short.
And there's no burning, there was no pain. It was amazingly seamless and amazingly easy.
Previous to the laser, I heard about the what they used to call in layman's terms the old rotor thing, and I was happy I didn't have to go through that. This one is virtually painless, so it's much better.
Other treatments require the patient to compromise safety or outcomes. You might have heard the stories. Prior to Green Light PVP, patients experienced prolonged hospital stays, greater risks of complications, including excessive blood loss, incontinence, and impotence with invasive surgery. Other lasers and heat treatments resulted in delayed urinary relief and compromised urine flow.
When he had the procedure, he had to have a blood transfusion. Then he had to put a catheter in him for, I don't know, it was 5 or better days. And after that, he had to wear Depends until he could control himself.
So how does it work? Green Light PVP uses a patented high-power green light laser to immediately vaporize and precisely remove enlarged prostate tissue. A thin, flexible fiber is inserted into the urethra through a cystoscope, an instrument that allows the doctor to examine the bladder and urethra. The fiber transmits green laser energy that quickly vaporizes and precisely removes the enlarged prostate tissue. Via the cystoscope, the physician is able to safely view and control the treatment area, tailoring it to each patient's anatomy and needs. Doug and Debbie Harris chose Green Light PVP for treatment of Doug's BPH.
The biggest thing is sleep at night, because every hour and a half, 2 hours you're getting up, and you're not getting a full 8 hours sleep.
Did you take medication?
Well, he tried the medication,
okay,
but really after a couple months we could see that wasn't going to work, so we had consultation. We set this up to have this procedure done because the medication really wasn't doing anything.
With Green Light PVP, Doug and his doctor were pleased with the results.
Any pain?
No.
Any burning, hurting? We just got you out of the operating room. You did very well. We will wait for him. Usually within 45 minutes to an hour, he will be able to urinate on his own, and we'll have his wife come and hold his hand, talk to him, and within an hour he should be ready to go home.
Greenlight PVP delivers the ultimate enlarged prostate solution. This unique and simple treatment to an enlarged prostate combines the effectiveness of the surgical gold standard TURP with the safety and ease of a minimally invasive treatment. Free from urinary symptoms, free from compromise, freedom to go.
Wives are suffering in that their sleep is broken right along with their husbands. When that man is up and down out of bed every hour and a half, every 2 hours during the night, their sleep is disrupted.
We got home and he felt like normal almost, you know. He took it easy, had to take it easy, and he felt so good that he really didn't want to take it easy. He wanted to do more things.
Most of the patients who are having the procedure done go home soon after the procedure. They are very happy to have had the procedure and be home within a few hours.
The Greenlight PVP laser procedure has been proven safe, effective, and durable.
To me, it's great. It beats, you know, the old conventional surgery, and can't beat it. I was here at 8:30. I was home at 20 after 11. Walked out of here, and that was it. You know.
It's so much easier on the person that's having it done, and the care of a person when it's over. I mean, it's like a piece of cake.
With Greenlight PVP laser procedure, you'll experience freedom from suffering from an enlarged prostate in a safe, fast, proven outpatient procedure.
It's great. I think it's something that should have been here years before to eliminate the problems.
It was so quick, and afterwards, like I say, it was so satisfying that I would recommend it to anyone.
The patients are happy that there's a fix out there, and it's something that they're not going to be laid up in the house for 6 to 8 weeks with, that they're not going to be able to go out and play golf for 6 to 8 weeks. They want it fixed, and they want it fixed yesterday. The results are immediate.
To determine if you have the green light for PVP treatment of your enlarged prostate, talk with your doctor or call the number on your screen.